Okay, so right now, the entire health insurance industry, it is in the middle of a massive, high-stakes battle. The ground is literally shifting under the feet of these corporate giants, and believe me, the outcome is going to directly affect the care you get and how much you pay for it.
And look, if you've been feeling this, you are not wrong. You're not imagining things. That sense that everything is just getting bigger and way more confusing, another mega merger, or maybe your doctor's office is suddenly owned by your insurer, that is not a coincidence. It's all part of this huge strategic battle that's shaping the entire future of American healthcare.
And this battle, it's literally causing the industry to split right down the middle. We're seeing two completely different kinds of companies emerge, and they're betting their entire futures on two totally different strategies for survival.
So on one side, you've got these integrated giants. They're betting they can win by owning everything: the insurance plan, the doctor's office, the clinic, even the pharmacy. And on the other side, you have the focused specialists. They're betting they can win by just mastering one single thing, like government programs for seniors or for low-income families. You've got two completely opposite bets, all happening on one massive battlefield.
All right, so here's our game plan for this explainer. We'll start with why the industry is dividing in the first place. Then we'll dive into what we're calling the managed care gauntlet that's forcing this change. We'll explore the two competing models, the all-in-ones and the specialists, and we'll wrap up with what all this means for you.
Okay, first up, an industry dividing. And the big question here is, why now? What has changed to push this entire industry to a breaking point where the old ways of doing business just aren't cutting it anymore?
Well, the answer really lies in this idea we're calling the managed care gauntlet. And you can think of it like this brutal obstacle course of new financial and regulatory pressures. Right now, every single health insurance company is being forced to run.
The most important part of this gauntlet, it all comes down to a number called the medical loss ratio, or MLR. So what it is the percentage of your premium dollars, your money, that an insurer has to spend on your actual medical care. The law says they have to spend between 80 to 85%. For the insurers, any little increase in that number is a direct dollar-for-dollar hit to their profits.
And man, have MLRs been on a wild ride. It's been like a total whiplash. Early in the pandemic, people put off getting care, so MLRs dropped, and insurers made record profits. But now, that care is rebounding with a vengeance. People are not only catching up, they're often sicker, and that's driving costs way, way up. This has sent those MLRs surging past the legal minimums, sometimes into the 90% range, which is just absolutely crushing their profit margins.
And then, at the exact same time, you've got the regulatory walls closing in. New rules are making it a lot harder for them to deny care through things like prior authorization. The No Surprises Act, that took away a huge source of profit and negotiating power. And on top of all that, states are squeezing how much they pay for Medicaid plans. So it's like a multi-front assault on the way insurers have always made their money.
So you're faced with this gauntlet. What do you do? How do you survive? Well, let's look at that first strategy, the one the giants are betting the farm on, the all-in-one model. Their answer is simple: get bigger and control everything.
Their whole strategy is built on this one really powerful idea: vertical integration. Now, what's that? It's when your insurer doesn't just pay the bills, they own the clinics, they employ the doctors, and they manage your prescriptions. The thinking is, why fight with providers over costs when you can just become the provider?
And the company that has absolutely perfected this playbook is United Health Group. It works like this: a patient gets a United Healthcare insurance plan. When they go see a doctor, that doctor actually works for Optum Health. And their prescription, it's managed by Optum Rx. See, it's a completely closed loop, all designed to control the total cost of care from the inside out.
The scale of this is just staggering. Optum, which is just the services arm of an insurance company, now employs or is affiliated with 90,000 physicians. 90,000. Think about that for a second. A single division of a company is now the largest employer of doctors in the entire United States. That right there is the power of this all-in-one model.
Okay, but what if you can't afford to build a fortress like that? That's when we look at the other side of this great divide, the specialists. And they're finding themselves trapped inside this gauntlet with way fewer options to get out. So let's take a company like Humana. They made a huge bet, an almost pure play bet on one single market, Medicare Advantage.
A whopping 80% of their entire revenue comes just from insuring seniors. And for years, that was a brilliant growth strategy. But now, in this new Gauntlet, that laser focus has become a massive vulnerability.
And that kind of concentration, well, it creates some extreme risks. I mean, being so hyper-focused on Medicare Advantage makes Humana dangerously exposed to any little bit of turbulence in that one market. So small changes to government rules, things like quality bonus payments or rate adjustments, they don't just hurt them a little bit. They can be absolutely devastating. And you can really see this when you look at the numbers. They are just stark. Let's say the government cut Medicare rates by 15%. The diversified giant, United Health, yeah, they'd take a significant hit. But for a specialist like Humana, it's a code red, 5-alarm fire kind of catastrophe. For one company, it's a bad quarter. For the other, it's a potential corporate crisis. That's the specialist squeeze right there.
And this squeeze isn't just happening in Medicare. The Medicaid specialists, companies like Molina and Centene, they're caught in the exact same kind of vice. On one side, you have state governments cutting what they'll pay. On the other side, their patients are sicker and more expensive to care for than ever. And without any other businesses to cushion that blow, they feel the full, brutal force of the Gauntlet.
Okay, so we've got this massive, high-stakes battle raging between the giants and the specialists. But the big question is, what does this actually mean for you, for your wallet? Let's connect the dots here and see who the real winners and losers are.
So when you boil it all down, the final take is pretty clear. That all-in-one model, the one a company like United Health is using, is like a powerful fortress that positions them to win in this new environment. But the specialists, they're just exposed. Humana's huge bet on Medicare has turned from a strength into a critical weakness. And the Medicaid-focused companies like Molina and Centene, they're just getting squeezed from both sides without the scale they need to fight back.
When you look at all this, everything seems to be pointing in one direction. A future that's dominated by just a handful of these massive, all-in-one giants. So the final question we're all left with is this. As these few companies gain control over every single piece of our healthcare, the plan, the doctor, the pharmacy, what happens to our costs, and maybe even more importantly, what happens to our choice?